Minister of Health, Dr. Zweli Mkhize, is in the Nelson Mandela Bay Metro at Dora Nginza Hospital for the second leg of his visit to the Metro. Yesterday, Mkhize visited Livingstone Hospital, where he engaged with health officials from various clinics and hospitals in the Metro about the challenges faced in the hospitals and what steps needed to be taken to rectify these. During his walkabout at Livingstone Hospital, he raised concerns about the cleanliness at the hospital, stating that cleanliness was was paramount in fighting the pandemic. Now, Dora Nginza Hospital is another hospital which has been in the spotlight for all the wrong reasons over the past few weeks. Our reporter Lerato Fekisi is in Port Elizabeth, and she's been following the minister around and also has been reporting on the state of the hospitals and the Department of Health and how they've been handling the coronavirus situation in the Eastern Cape, but particularly in that area. So, Lerato, what you heard coming out of the minister, I can imagine, was not too much of a surprise to you, because this has been uncovered.
Definitely it has been uncovered, and I actually feel like I'm having a deja vu moment, because 3 weeks ago we were actually standing at the same place and were speaking to a doctor who works at Dora Nginza Hospital, and I can still imagine his face and the trauma that he was experiencing at that time. I asked him exactly why does he feel so stressed, and he says, Lerato, what's happening inside this hospital is so traumatizing. The maternity ward is a disaster. There are women there who are losing babies every single second. The casualty ward is a disaster. There are corpses lying around, and then subsequently, about 2 or 3 weeks after that, there were photos circulating on social media showing the catastrophe inside this hospital. After that, Leanne, we saw the BBC coverage showcasing the dire straits in a hospital in the Eastern Cape, and I think that's why the Minister of Health felt it important for himself to come down here and see how bad things are. Like you alluded in your intro earlier on, you said that the issue of cleanliness was an issue. During our walkabout yesterday, Livingstone Hospitals, there were various places we stopped at, where the Minister of Health would ask, why is the waste, especially COVID waste, why is it still lying around? Why has it not picked up? And the MEC of Health, Cindy Sogompa, has vowed that a company is going to be deployed to the hospitals and will start a deep cleaning at all the hospitals. So there definitely is an issue within our hospitals, and the Minister of Health was saying at a time when numbers are peaking, we cannot have hospitals that are dirty, because when a patient comes who's sick and is wanting help and they see refuge lying around in the hospital, automatically they're going to become sick as well. So you are saying that another issue is the issue of poor management, because a dirty hospital has nothing to do with patients, but more to do with managers are not doing their job properly. So we are hoping that as it comes Dora Nginza this morning, he's going to see the real picture of how things are and how bad of a situation it is inside this hospital. And we are hoping above all that just beyond just the talk shop we've seen in the past few months, they're actually going to deploy more staff, because the issue of staff is also an issue in this hospital. More PPEs, they're going to also bring better resources, because that's been a complaint also at this hospital. So the people here are saying, with the minister's visit, beyond just the walkabout and seeing the problems, he's going to put time frames and say this specific issue must be dealt with and must be sorted out with a specific time, and people must be employed, nurses and doctors must be deployed here, because what we're seeing here is really not good, especially at a time when the numbers in the Eastern Cape and in the Metro are rising at such a rapid rate.
Now, we saw the numbers coming out, Lerato, yesterday, and there was a sharp increase in the number of deaths that were reported here in South Africa, as well as about the infections. There's also been a big question mark on the reporting and the numbers coming out of the Eastern Cape. What did you, I mean, obviously you've seen the numbers today, and I mean, you wouldn't be privy to the information, but, you know, in terms of the massive question mark around the numbers coming out of the Eastern Cape, do you think that this is actually a major concern, and should we be worrying about what's going on there?
During his address yesterday to the health officials, he did stress the importance that the number of deaths be captured correctly, consistently and concisely. He said that at a time where the pandemic is peaking, it cannot be that the issues of death and the number of deaths are not being corrected and not being tabled correctly. This follows Leanne, the MEC's visit to the Metro on Tuesday, where during her walkabout she picked up that over the past 2 weeks, the number of deaths in the Nelson Mandela Bay Metro have not been captured properly. We then asked her, is some someone going to be penalized? Because it cannot be that people are dying due to COVID-19 and the issue of stats is not being recorded properly. And she said that she has asked that an investigation be done, and should it be that someone is held liable for this, they're going to obviously get the right consequences, and people are going to be held accountable, and people are going to have to take responsibility for this, because it cannot be that we are taking such a huge risk of not tabling such important numbers.
I have to ask you about the scooters, because the scooters are a major problem. When you have a province that's dealing with filthy hospitals, and then you have another issue of this whole scooter issue that the minister has said he never authorized the spending of this, and yet the province is saying, no, well, we're still going ahead with all of this. What's going on? Was that addressed at all?
Yesterday, the issue wasn't addressed at all. I think his main focus yesterday was to do a walkabout at the hospitals. Even during our press briefing, it wasn't even a question that actually came out, or even a statement that came out from him. But the major concern was to ask, with the issue of especially poor infrastructure, because these hospitals, Leanne, have been here for over 20 years. So someone would ask, why not direct the money to the hospitals? Why not take the money that you had set aside for scooters, which have proved are not going to work in this situation, and direct those funds to hospitals, or direct those funds to more PPEs, or direct those funds to getting more nurses and more doctors, which is more of a need than scooters at this time. So we are hoping that during the press conference today, which will be more broad and more in-depth, such questions he's going to answer, to say, with all these funds that are available, which we know now are available because they've gone to the scooters, could not those funds go to more urgent needs, especially at a time now where the numbers in the province are rising? So we are hoping that the Minister of Health is going to give us clarity exactly where about is the issue of the scooters. Are they still operational? And shouldn't it be that those funds be directed to more needed areas within the health sector?
So finally, Lerato, sorry, I know that I got to let you go, but there's so many issues coming out of the Eastern Cape. We need to keep our finger on the pulse there. There's been a call from the DA to put the province's healthcare under the national government and under administration, basically. The minister, to quote what he said, is that he said national government taking over would only happen if there was a complete loss of management. From what we're hearing, it almost feels like there's a complete loss of management. What do you think will happen on this matter?
Yesterday, the Minister of Health did also allude to this issue, and he said that, and I quote him, that at this moment they don't see a need for them to take over the Eastern Cape Health Administration, because number one, there is no breakdown in management, and also number two, there's been no issues where people have been given instruction and have not done it. So he did say yesterday, both on two occasions, that at this time right now, he does not see a need for the national government to take over the administration of the Eastern Cape Department of Health.
All right, we leave it there. Lerato, thanks very, very much. I know you're following the Minister the whole of today, and we hope to get a lot more coming out of that province, and certainly more for the community members and the people living in the Eastern Cape, a better quality of healthcare as well.